Hello, and welcome to Ask Dr. B. So, I'm going to continue a conversation that I began in a prior video about anxiety. In that video, which you can watch, I talked about thinking how we can think about anxiety in general, how we experience it. I talked about different categories that we mental health professionals use to understand what specific configuration of symptoms, what someone's presentation might be, and that we do that because, well, first of all, humans like to categorize things. It helps our brains think about things, develop treatments and approaches for a specific cluster of symptoms, if you will, helps us study what's going on with people who experience anxiety as a result of this, for example, with post-traumatic stress versus somebody who may be experiencing anxiety because they're experiencing unwanted thoughts, ruminations, obsessing about things. And so I talked about all of that. And in this video, I'm going to talk about the issue of intensity, duration of your symptoms, the severity of what you're experiencing. And I'm going to talk a bit about medication, not which medications or anything about the specifics of medications, but just to help you think about the medication as one potential tool as you're dealing with anxiety. I am not a prescribing mental health professional. I do not prescribe medication. I'm not licensed to prescribe medication. But I know about when someone like me, a clinical psychologist or other mental health professional, would work with a prescribing physician, a psychiatrist, or another prescriber to talk about medication and when it might be indicated. And that's really what I want to talk to you about. This question that came in about how to manage anxiety without medication, it immediately made me think about, many people don't want to take medication, or they want to get off of medication as quickly as possible if they need that medication. And I'm going to touch on that too, the sort of the challenges of taking medication or being prescribed medication. But before we get there, I want to talk about why medication might even be part of the conversation. So let's say that you're experiencing anxiety, and for some people, it can be that a condition, whether it's social anxiety, where you really are uncomfortable around other people, or generalized anxiety, where you just are worrying about all kinds of things all the time, could be that it develops gradually over time. Could be that there's life stressors on you that are contributing. And so it's, kind of things are pressing on you from the outside and on the inside. Or it could be a condition that is a manifestation of trauma that you've experienced. You've experienced trauma, and now you have these symptoms that perhaps people are referring to as post-traumatic stress. So let's say that you're just really suffering and struggling or really uncomfortable. It's interfering. That's what I want to talk about. What does that look like? How do you know that I need to do something here? It's not manageable. And by the way, you deserve relief. So if your symptoms, whatever they may be, and again, I got resources in the details of this video, and I talk about this in that prior video. If you are experiencing symptoms that are interfering with many other parts of your functioning, you're sleeping, you're eating. So sleeping, I can't sleep. I wake up, either I can't go to sleep, or I go to sleep and I wake up in the middle of the night and then I can't go back to sleep, insomnia. Or I, am too anxious to eat. I can't eat. Or interfering with my ability to do my work, my schoolwork, I have intrusive thoughts, the worries are bombarding me, or I can't focus because I just feel heightened and, agitated all the time. Relationships, it's interfering with my relationships because I'm constantly worrying and I need to go through rituals to check things that make it difficult for me to have my relationships, feel effortless or easy because I'm constantly having to explain to people, no, I have to do these things. Or my anxiety is such that I can't have relationships because I'm too uncomfortable to be out in the world. So that's about the severity. How much is whatever you're experiencing interfering with your day-to-day life? And then the duration, how long is all of this been going on? As I said, it could be that it comes up. There's a certain amount of anxiety, worry, agitation that we would expect to feel after some kinds of events that might occur, such as, we get into a car accident. That's traumatic. And so having those experiences for a period of time would be very understandable. But if it's been weeks, months, hopefully not years of this level of distress, then it's absolutely important to see someone, to get some help, to better understand what's cause of this, what's the root, to start working on strategies and programs and techniques to address the anxiety, because here's a really, really important thing to underscore. Treatment works. Now, there are a variety of different kinds, which is why I have resources, which is why it's important to think about which kind of anxiety, which kind of condition are you dealing with, because different approaches, different treatments can be helpful for different conditions. It sounds complicated, but that's partly why I'm doing this show, to help people think through how to think about which treatment, which approach might be best for you. But if you're experiencing the level that I just explained, where it's really interfering day to day and making your world and your life, uncomfortable chronically, and your world smaller, it's really time to seek help, get help, to get a good assessment, so that you can then move forward with a plan of action. Okay, so now you've determined, which one of these general categories, I mean, they're kind of specific, but what I said in my prior video holds here too. You may not fit exactly in any bucket, and you may experience pieces of different ones of these categories. That's okay. But let's say you've now gone, you have a better understanding. Yes, this is what's happening. And someone, your mental health professional, your healthcare professional, has suggested medication. So the reason they're suggesting medication is because of the severity, the intensity, the duration, and they want to get you some relief. One thing that I will say about sleep: anxiety can really interfere with sleep, and our sleep is critical for our functioning. So if you have experienced trauma or a loss or something acute and you are not sleeping, a physician may really want to address that with medication to help you sleep, so that your body can start to heal, and psychologically you can start to heal. Again, medication is not the only way to get back on track with sleep. And I'm sure down the road, I'll do a video on sleep. Well, I know I'm going to, because it is so important. But I'm just trying to, again, explain why a physician might say, look, we need to address this, or a psychiatrist might say, look, we need to get you sleeping. That's really critical. But also to manage those symptoms so that you can function day to day, so that you can go about your life, go about your work, your school, your relationships. Medication can be helpful in that it can, the right medication, the right person, right dose, all of that can be helpful in addressing symptoms. That's a true statement. Getting there can be challenging, meaning, and this is one reason why people often don't want to go the medication route, or they want to stop, or once they're in that process, it can be difficult. I promise to always say what I believe, and others may say other things, but this is my 30 years of experience, and I think a lot of people would agree. Medication is not yet precise enough. There are classes and there are medications that we know work well for certain conditions. That's all true. But each individual is an individual. It might work very well for you on the first try. You might have to try different doses, a different medication. Is that worth it? Absolutely could be worth it. If this is interfering in your day-to-day life, absolutely. But I want you to know that. And so that's one of the challenges with medication, that, it's like medication for everything or anything. So know that, develop a good relationship with your prescribing healthcare professional. Make sure that you and that person have a good conversation about, how you're experiencing things, and check in regularly and all that if you decide to go that route. So that's one of the challenges. One of the benefits is that it really could relieve your symptoms and make a huge difference in your life. Sometimes, if that happens, then you may decide when you want to taper off the medication, and maybe now you've started employing other practices to manage your anxiety, which we're going to talk about in a future video. And then you don't need medication, or you don't need that medication. But I definitely want to underscore that no one should hesitate to try medication if you are suffering and you want to. You shouldn't feel like, oh, I got to be tough, I got to do this on my own. You can feel that way and go that route too. But I just want to speak to the people who feel like, gosh, I'd be willing to try, but maybe I should tough it out. If you're suffering, medication can be absolutely key to helping you feel like yourself, feel healthier, and engage in your life. So that's one on medication. Another reason why people sometimes are reluctant to go on medication is they're concerned about side effects. Again, do medications have side effects? Some do for some people. They're very clearly explained in all the materials that come with the medication. Your prescribing physician or mental health professional will talk to you about all of that, ask your questions so that you are knowledgeable and you are a good advocate for yourself. Or if you're seeking medication help for a loved one, make sure that you are being a good advocate for them. So could be side effects. There are also things that you can do in response to those side effects to manage those. So again, not reason to say no, never, but be aware and be mindful. And let's say that you find that you're going to give medication a try. The medication is helpful. The symptoms are lessening, and that's all great. I personally believe strongly that even someone who is on medication, whether it's for anxiety or depression or other mental health challenges that, again, are part of the human condition, I believe very strongly that it's also important to engage in other behaviors, other practices to address those things that you can in your life that are contributing to the anxiety. Whether that's therapy, and again, there are different kinds that might be helpful, and it's okay if one kind doesn't really do it for you, but finding another one that really does, so don't give up. Whether it's meditation, mindfulness, whether it's exercise, which is really helpful to combat anxiety, journaling, movement therapy. There are so many things, and I'm going to talk about some of these techniques and tips in the next video in this series. But sometimes people will go to see a healthcare professional and they're prescribed medication for their anxiety, which is great. But that may be all that is suggested, or maybe other things are even suggested, but the individual says, well, the medication is doing the trick, and so I'm good. Please think about some of these other techniques and strategies to help you really have a healthy life that you want. The medication, again, can address the symptoms, and that's good if that's the direction you go. But regardless, please consider some of the other ways to take better care of yourself and to help the people that you love take better care of themselves. That's all for this video. Thank you for tuning in. Again, thank you to the person who sent in this question. So important. I suspect there'll be over time several different nuggets about different sort of kinds of anxiety that I'll be creating as people ask more questions. But I will have another in this series specifically focused on tips, strategies, techniques. And you can do all of those and medication, or all of those and not medication. The goal is really to find out what works for you, because one size fits all. But I am going to stop with one more thing that I want to underscore about medication. Don't let yourself continue to suffer because you feel like you should do it without medication. Medications have been created, developed, tested, researched, and again, they're not perfect, but neither are we. And so if you are suffering, please consider, if that's what's being recommended, talk to your healthcare professional. And I look forward to answering more questions that come in. And thank you again so much.